So I've been invited to speak because I'm a person who talks a lot about dying and death, because I've worked for 30 years in palliative care, 20 of those as a consultant running big and busy services in a hospice, and then later in a big hospital service. And you probably know that palliative care is really not about dying. It's about quality of life and living and enhancing people's quality of life, reducing the symptom burden they're carrying when the illness they've got can't be reversed to take their symptoms away. We're the people who come in with expertise to manage symptoms by different routes. But because of that, we meet a lot of people with advanced disease, and that means that we work with a lot of people at the very end of their lives. And so I took early retirement because I had expected that within 10 years of palliative medicine taking off as a specialty, and you need to know, Scotland, that it took off as a specialty under the leadership of the wonderful Derek Doyle, who was the medical director at St. Columba's Hospice in those days. We really thought we would educate ourselves out of a job within a decade or two. And yet 3 decades later, I was still seeing people who were not sure what dying would involve, frightened of what they thought would happen, terrifying themselves because they knew little but imagined lots, largely lifted from newspaper headlines or soap operas. And I thought, really, we need to try and address the public understanding of dying. And the way I was fortunate to be able to make a contribution to that was by writing a book about the way people live while they're dying. And I thought that was it. I thought I'd done my job. And then the correspondence started. So this is the book. It's called With the End in Mind. And I got so much feedback from the public. And some of it was saying, thanks for explaining that, because actually I'd misunderstood what I saw and heard. And I thought something much more frightening and difficult for the person I love was happening. And understanding it better makes me understand that they were almost certainly deeply and safely unconscious. But they also said, we need to talk about this, don't we? And I have no idea where to start. I'm frightened that if I do start, I won't know where to stop. I'm frightened that if we take the lid off this, family dynamics will never be the same again. Or I'm trying to talk to my family and they won't let me. Or I'm trying to find out what my parents' wishes are. I'm named as an attorney, but they don't want to talk about it. How do you start a conversation like that? Now, when you write a book that becomes a bestseller, which is not a sentence I ever thought I was going to say in my life, your publishers then want another book. And they were really keen that I should write a second book. And I really didn't think I had anything left to say. But as this correspondence came in, there was another correspondence too. And that was from health and social care professionals. And it was almost the same. I don't know where to start. What happens if I upset my patient? What happens if somebody complains about me because I started a conversation they didn't want to have? What if I end up in trouble? Or, yes, it's really important people talk about this, but shouldn't the GP do it? Oh, shouldn't the nurse specialist who knows them best do it? Shouldn't the hospital specialist who understands the illness best do it? So everybody passes the communication parcel and everybody hopes the music won't stop while they're holding it. And I realized that I've got quite a lot to say about communication skills. I've taught communication skills to medical students and nursing students my whole career. I'm a cognitive behavioral therapist, so I've got a very particular view about the way we communicate with each other. So I went back to my publishers and said, I think I might have another book in me. And they said, fantastic, but we don't want another death book, which was somewhat awkward because that is in fact what I know about. But of course, like all of us, I also know about life from its beginning to its end, from the rest of my life, from being a sister, a daughter, a friend, a wife, a mum, a trainer, a teacher, a supervisor. So I was able to start to think about those conversations, those questions about conversations. And now that I was thinking about it, I started to notice something you might have noticed as well, which is a tendency for these conversations to be described by what's difficult about them. Because they are delicate conversations and they might require us to be quite courageous to step up. And they certainly need us to be skilled. And in healthcare, of course, that's something we can learn and practice and polish. But even amongst our families, it can feel daunting or difficult, or, you know, if you've got a very grumpy relative, it can even feel quite dangerous. So the circumstances do feel challenging, but it's about the emotions that might arise during the conversation. So I think part of the difficulty we have when we think about these conversations is we see adverts for courageous conversations, challenging conversations, difficult conversations, and every one of those words clips on a piece of armor so that we're strong and we're ready and we're going to do it. And I think that's exactly the opposite to the attitude that these conversations require, because the difficulty and the challenge and the delicacy of the conversation, it isn't the conversation's fault, and it isn't the fault of those of us who are engaged in the conversation. So I would like us to actually take off our armor and think about bringing our tenderness instead. Tenderness is the word we use when we're describing something that's very close to pain. When I was a medical student, I was taught how to examine a tender abdomen. Really important to examine it very carefully so you can work out whether the problem is with this person's gallbladder or with their appendix, or maybe it's their liver or their spleen or their guts or some other organ. So you need to feel the abdomen very carefully, and yet every time you stick your fingers in to feel, it's painful. The abdomen is tender. And I was taught by a pediatrician to take the child's hand that I was examining and put their hand on my hand so they knew where I was. There were no surprises, that I asked permission, that I moved gently, that I watched their face, not our hands, so I could see if there was a flicker of discomfort. What we're doing when we're moving around something that's tender, whether it's an abdomen or a conversation, is we're bearing in mind the other person's pain, that we're close to their pain, and we're trying hard to work out a way through to help them. We're trying not to make it any worse. So we tender our attention. We bring our tenderness to the fact that they might be in pain. So I've chosen tender very deliberately and very provocatively. So let's think about tender conversations. To start off with, to write about them, I thought I might use the metaphor of a toolkit, you know, where you do one thing, then you do the next thing, then you do the next thing. And then I realized that wasn't going to work because, first of all, a toolkit is a sequence. You know, I might use one tool and I put it down before I pick up the next tool. And in a conversation, I don't stop listening and paying attention when I speak. And I don't stop thinking about the meaning of your words when it's your turn to speak and I'm listening. We're doing lots of things all at the same time. But also, of course, DIY, using a toolkit, putting a shelf on a wall, I'm doing something to the wall. I'm doing something to the shelf. A conversation, I'm not doing a conversation to you. We are engaged together in a conversation. It's a joint and collaborative venture, and we're doing it together. So dancing seemed to me to be a far better metaphor, where each of us is working together to make the dance work, to not trip over each other, to hold the space, to take steps forward and backward in time to the music at the same time, a little bit like speaking, listening, taking turns, mulling things over, wondering, checking out, looking things up, finding more information, coming back together again. It's very much more like a dance. And the other thing I like about the dance metaphor is, I don't know about you, but I'm not a terribly good dancer. So I might tread on your toes. I might trip us up. But if I did that, you would hold me. You would help me. You would pick me up. You wouldn't think I had deliberately hurt you or deliberately tripped you. And in these tender conversations, sometimes we say something, and even as we're saying it, we're thinking, oh, that didn't sound like that in my head. And it's okay to say, oh, I'm really sorry, that sounded insensitive when it came out of my mouth. I didn't mean it like that. Can I say that again? And we help each other and we steer each other around the conversational dance floor, creating the space in which we can think together. So I decided But dance was the metaphor, and I needed to think, what are the principles? What are the things that happen when we are communicating together? And these are the principles that I've written about. And these are partly from my own experience as a trainer and as a cognitive therapist. And they're partly because COVID gave me an absolutely wonderful opportunity that wasn't at all expected, which was that having retired, I was sitting here in my tiny but lovely little cottage in Northumberland, watching the news, reading the newspapers, realizing that people were dying in large numbers, being cared for by people who had never looked after a dying person before. This was a newly qualified staff nurse who was working in an orthopedic ward that looks after fit young men for joint surgery. And suddenly she's looking after people who are elderly with overwhelming pneumonia, who are dying and their families aren't allowed to be there. Who's teaching that nurse how to have those tender conversations? Who's supporting that newly qualified doctor to be at that bedside and feel that they know how to approach the conversations or make those really tender, unwelcome news phone calls? So I was given a task by NHS England, but on behalf of the NHS across the United Kingdom, to work with a small group of people to generate a communication skills framework. What an absolutely wonderful opportunity. And we used research from Loughborough University, research about conversation analysis, which actually shows us what are the things that happen in a conversation that help the conversation to feel safe, compassionate, and purposeful to the person who's engaged in a conversation with a healthcare professional. And so over those first few months of the COVID pandemic, I was working with people who were helping me to distill out that research. And then I went back into the NHS as a staff supporter and a communication skills trainer, and then came out at the other end with only a few months left now of my contract to deliver the book. I hadn't written a word, but I'd actually been completely enmeshed, if you like, in the practical, which had helped me really to realize that these are the principles that count. So let's have a little think about them together before we start our discussion. So the first thing that came from the correspondence was a sense from people that if I could just get my dad to talk to me, if I could just get him to sit down so I could tell him what I think, we could solve this. If my children would just stop closing me down and let me say my piece, we could sort this. But why is dad closing you down? Why do your children not want to listen to this conversation? What's the missing step here? And I think the missing step is, again, from the dance metaphor, an invitation. We don't, at least beyond our teens, say, you, me, dance now. We have conversation and we are courteous and we invite, and an invitation allows somebody also to say no. So if you want to talk about something that really matters, then it has to be at a time when you're both ready, you have the time to give to it, and that you're going to bring an open mind along to it. So rather than insisting, we need to be asking, would it be okay, please, for us to talk about? I'm worrying about something and I'd really like your opinion about it. I've been mulling something over and it would really help me to run it past you. Or you asked me to do you the favor of being your health attorney, but I think I've got some questions that I need your advice about if I'm to be able to speak for you. It works both ways, that if somebody invites us at a point where we're not able to respond, we can also say, actually, that is really important. But right now I'm running for a bus, I'm on the school run, I've got to pick up my grandchildren, whatever it is. I want to give this the attention it deserves. So I can't do that right now, but will you phone me later, or shall I call you later and we'll arrange a time when we can sit down and really think about this? And that works whether it's a friend you bumped into in the supermarket or somebody who bumps into you in a corridor at work who wants to talk about something that's their burning issue right now. And actually you've got a different burning issue that you're on your way to deal with. So an invitation allows us to set a mutually agreed time and to give this thing that needs attention the attention that it actually deserves. Once we get down to sitting and thinking, though, there's something else that I think is really important. When we watch a master communicator in action, there are some things that we notice about what they do. And one of the things that we notice is that they tend not to say a lot. They tend more to listen. They tend to ask questions rather than make statements. And then as the person's answering, they pay really careful attention to the answer and often ask other questions to fill that answer out more broadly or to dig more deeply into that answer. And when we are really listening to somebody, listening to understand, it's not about what we're going to say. We don't know what we're going to say until we've listened to what the other person thinks, believes, is worried about, is concerned about. And our response is a response to their response. So we need thinking time. And the thinking time will build silence into these conversations. It slows them down. So we need the time to listen and reflect and then check that we've understood. And it turns out I've been using a dance metaphor for years without really noticing it, because I've always said to medical students, and I said it again just 2 nights ago, when you're listening to understand, ask a question, ask another question to get more detail, and then before you move on, just give a little summary that says, can I just check before we move on that I've understood what it is you mean? What I think you've said is, but tell me if I'm wrong. So offering it back in a way that allows the person to say, yes, that's right, or oh, no, actually, it's a little bit different from that. It's really this, to clarify for us. And so I talked to them about a question summary waltz. So the dance has been going in the background for a long time. So if we're listening to understand, we're using questions, and children are our role models for this, their curiosity. It's not that we're here to tell you something, to put you right, to fix it. We're here to understand it. And curiosity allows anything to be possible. Imagine being a child who understands, is told for the first time that that butterfly used to be a hairy caterpillar. How astonishing! And yet they accept that that unexpected thing is a truth, and they ask us more questions about it. So our curiosity comes out in the form of invitations to tell me more about something, or I'd really like to understand better what it was like for you when that was happening, or how you felt as you realized that this situation was developing. Help me to put myself in your shoes and understand it. And what we're really doing is asking the person to tell us their story. And as they tell their story, we're listening carefully, but they are listening too. And that's one of the things that really helps. So you'll all have had the situation of, you wake up at 3 o'clock in the morning and you realize that we're all doomed. And there are so many difficulties, and there are so many things that we can't solve, and they're all floating around in your head, and you can't get hold of any of them to sort them out. And as day breaks, it feels a little bit less gloomy. But actually, it's not until we sit down to describe the difficulties to a friend that we realize that we can only describe it 1 sentence at a time. And so we start to tell the story 1 sentence at a time. And it helps us to get hold of all of those different floating pieces. When you're listening to somebody telling a complicated story, you notice that they say things like, oh, so this is what happened first, and then this happened, and then this person said this, and that person said that, and then, oh no, hang on, that wasn't then. That thing happened before that thing. And what we realize is that as they're telling us their story aloud, they're also assembling it and making sense of it. So our curiosity, our offering of the time simply to listen, isn't just passive. It's a really active process that helps somebody to walk themselves through a difficulty or a dilemma or a difficult experience and understand it in a new way as they assemble it in their minds. So when we're using questions to help somebody to get to that fuller picture, there are two time frames, if you like, of the questions we can use. And I want you to think about this really carefully, because there's one time frame that's more comfortable for us, and there's another time frame that's more helpful. So the most helpful one is questions that help the person to really think not about how they're going to fix it, but what it is that's going on at the moment. And because largely those of us who are people who are spoken to by friends for support are people who like to help, our comfort zone is to go to fixing. So I'm going to invite you to come back from fixing and stay in the current situation, which may be uncomfortable, maybe a dilemma, maybe full of sorrow, and ask more questions about it. Making sure that we've really understood what it was like for that person, what sense they're making of it all, whether there could be other things that are part of this that we haven't discussed yet. What's your spouse's view of this? What are your children's view of this? What did your boss make of it? Could there be a different way of interpreting this? If a different person was in this situation, would they see it the same way you do? And what we're really doing is we're helping them to assemble the jigsaw of all those different bits that were floating around in their heads. And these are the questions that help them to just shake the bag and make sure there are no bits of the jigsaw stuck inside it, before you are in fact allowed to go to the questions that are about possible ways forward. But even now, these are questions, these are not suggestions, these are not advice. This is not saying, if I were you, what I would do is, because if you think about it, this person we're talking to is an intelligent, sensible person. If the fix that we can think of now, having just listened to them for a few minutes, could have fixed this, they would already have thought about it, they would already have done it, and it would already be fixed. So our offering to fix actually isn't helpful, and often can just show people that we haven't really understood how completely stuck they feel in their situation. So instead, let's use questions that ask about what they've tried so far, or whether there's part of this that might, even if it's not the most important bit, might be more easily changed, and would changing just one thing a little bit help everything to feel just a little bit less tense or difficult. Or if life has given you difficult experiences in the past, what did you learn from those experiences that you might be able to apply in these circumstances? And then this really fantastic question for a person who's completely stuck. If you had a friend who told you this story, who was in this situation, what advice would you give that friend? And it is astonishing how often people who feel completely stuck can think of a way that they would advise a friend. And now we can think about what parts of that advice might they be able to apply here. But as they're talking about their situation, it's likely that they are going to re-encounter the distress of the situation. And this is where it's really important that we step backwards out of the wish to make it better, because actually we're being trusted to know the depth of it. And that's a real compliment. And if we try to fix it, or if we try to reassure them that it's not really that bad, what we're really saying is, I don't like it that you're distressed. It's making me feel uncomfortable. So I'm going to do something now that cheers you up in the moment. It doesn't do anything to solve your dilemma, but it makes me feel better. It's not okay for me that you are so distressed. So instead of that, we're doing the opposite. What we're doing is saying that I am prepared to be here with you in this sorrow, in this difficulty, and just hold you while you experience it. And it can be really hard to do that. And it can be particularly hard if we're trying to do it down a telephone line, which of course we all had to do in healthcare during COVID, and which you may have to do because you're a long way from the person you're talking to, or they're shielding, or whatever it is. So to be able to say, this is really hard. I'm really sorry this is so hard. You take your time. Thank you for telling me this. I feel honored that you've shared this with me. I'm not in a hurry. We've got time to sit with this. And there will be silence. And silence is not awkward. Silence is necessary, because in the silence is where we think. In the silence is where people make their minds up, where they change their minds, where they realize something, where they see how the dots join up for the first time. So we need to be quiet, but we need to remain present. So if we're with the person and they're distressed, we can hand them a tissue, make them a cup of tea, stroke their shoulder, touch their hand. But what we need to do is just sit on what's bubbling up from inside us, which is our desire to explain, excuse, add details, give them fixes, make suggestions. No, we will be quiet companions as they think. We will ask questions that help them to examine the options, and we will let silence do its compassionate and important work. Of course, there will come a time when we need to finish our conversation, and we need to do that in a safe way as well. If somebody has revealed the depths of their emotional distress to us, it's really important that there's a safe way of closing for them and also for us, because it hurts us to be in the presence of people who are hurting. The tenderness that was originally to their pain is now to both our pains. So to finish safely, we need to be aware of time. We need to remind each other how much time there is. We need to give a warning shot towards the end so that the person can start to gather themselves. What we don't want to do is send somebody out kind of emotionally naked. It's like putting your coat on before you go back out into the cold. And one of the ways we can do that is to help somebody to orientate back to the here and now and what's going to happen next. So thank you very much for telling me all of that. We've only got a couple of minutes left before your bus or before my school run. So before we part now, just tell me, has anything about the situation changed as you see it now? What do you think you need to do next? Where are you going now? How are you getting there? Who else do you need to talk to about that? When will you do that? How will you contact them? So we're bringing the person out of the dilemma, out of the distress, and back into much more practical daily matters. So we're ready to part from each other with kindness and arrange maybe when we're going to see each other again, if that's going to be part of the arrangement. If you're a person who's regularly turned to by your family and friends, or if you're a person who works or volunteers in a caring capacity, then you need to look after yourself each time you have one of these conversations, or you will run out of fuel. So how do we look after ourselves? Well, these are the things that staff in the NHS told me that they did after each of their tender conversations during COVID, that they would take a few minutes to recenter themselves. And they did that in a way that suited them best. And the organisation that we were all working in was encouraging managers to add 10 minutes to each of these interactions where somebody was breaking unwelcome news, for example, or helping a family to have a last video call with a dying person. Imagine being that companion. And so an extra 10 minutes to just regroup. And some people would choose mindfulness or prayer or deep relaxation. One of the apps for mindfulness that you can get on your mobile phone, Headspace, was made free to all NHS staff across the country during COVID and may still be free to download. Some people just went for a cup of tea. Some people wanted to see nature, feel the breeze, look at the sky. Sometimes in hospital they weren't allowed to go outside because they couldn't take all of their PPE off. So maybe they were looking at photos on their mobile phones or just looking out of a window. Some people used their phones to listen to music or to phone a friend. And some people just had a good old cry or a good old shout because that's what they needed to do. But it's not just immediately afterwards that we need to look after ourselves. We need to think of how we look after ourselves in between times as well, that we're getting enough sleep, that we're getting enough exercise, that we're eating well, and that those conversations that take us to a difficult place, we reflect on, maybe with a friend, maybe by writing or journaling. In a professional or volunteering capacity, we should have access to supervision, not a supervisor who tells us what to do, but psychological, emotional supervision, where we can debrief and go back through things that we've found difficult, to reflect on them in a safe way, in a tender conversation that's very like the tender conversation we might have had as somebody's helper. And of course, it's really important too that we take relaxation time. So as we draw to a close, I'd just like to invite you to reflect for a moment on how you think you feel about the idea of tenderness as the medium that we're dealing in here, and what you think it would feel like to be somebody who listens entirely without judgment, entirely without reassuring or trying to fix things. And I know that I'm a terrible fixer. I catch myself and have to stop myself all the time. And particularly when I'm dealing with the young people in our family, I want them not to make the mistakes I made. And of course, they need to make their own mistakes. So I'd like to invite you to just take a moment to think about, are there one or two things that you'd like to try differently in your important conversations, just to see what happens? And if you've got something to write on now, or if you like, you can stick it in the chat. Would you like to make a commitment to try an experiment of doing one or two things differently sometime in the next week to 10 days, just to see whether the conversations go in the same way they always go, or whether something different happens, whether that's helpful or whether that doesn't feel very helpful? It's what in cognitive therapy we call a behavioral experiment. No prejudging, open mind, try the experiment and see what's going to happen. So I'm going to bring the slides down now, but before I do, I just want to thank you all for turning up. I want to thank the Faith in Older People organisation for the invitation to speak, and to Malcolm Goldsmith's trustees and family and his lovely wife for endowing this lecture, and to lovely Richard for being with us to join the conversation, and for the last few years being such a great encouragement and wisdom figure for me. Thank you all very much. Let's be able to see each other again now. I stop the share. And oh, there are all your smiling faces. How lovely.
Thanks for that tender wisdom. I had prepared some questions and I'm going to come to them. But one of the things that immediately came into my mind, or progressively came into my mind, is there a male-female difference in all of this? Oddly enough, I was thinking, and one of the questions I'd scribbled at the end to ask you was about how do you apply the tender conversation wisdom that you have to politics? I mean, we're living through a hideous war in Europe. There's no tender conversation going on. And I'm wondering, is there something particularly about what you might describe as the armored male ego that makes the wisdom of tenderness particularly difficult to access? I mean, I know it's a complicated kind of question, but you wonder about what the psychological makeup of Putin, for instance, is, a man who's capable of creating enormous misery for it. Can you apply some of this wisdom to that? I know it's a much, much bigger picture.
It's a great question, Richard. And in fact, Professor Ruth Parry, who's the conversations analyst expert who was advising my little group, just posted something on Twitter yesterday. And it was a short video illustrating a male ego meeting a male with no ego. And it was Boris Johnson striding through the street in Kiev to greet Vladimir Zelensky, and sticking his hand out and saying, blah, 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 Boris, how are you? And Mr. Zelensky just said to him, you know how I am. And I think it was a perfect illustration of bluster and bravado and business as usual from the British Prime Minister and the Ukrainian president with his emotional armor off, saying, this is terrible, we are utterly exposed and vulnerable, you know that. Why this pretendy bonhomie? This and almost, he could see this is a photo opportunity for you back at home. This is not about your concern for me or my nation. So I do think that it may be that some of us are more naturally tuned to allow ourselves to take our armor off than others. I'm not convinced it's entirely a male-female thing, although my fellow end-of-life campaigner, the actor Greg Wise, has said in a very politically incorrect way that he said to me, tender's a girly word.
Yeah.
And perhaps, in fact, it is. But I think it's a virtue that we can all espouse. Maybe it's a little bit more difficult to step up to it if you're a person who is armored because your life experiences so far have shown you that it's not safe to take your armor off. And it may be that the way we educate boys and the way boys play with each other makes that more difficult than the way we educate girls and the way young girls play with each other. But when we see emotionally intelligent leaders in action, I think what we see is modeling of openness, integrity, humility, and curiosity. And they are the characteristics of what I would call a tender conversation.
Still, if you don't mind sticking to the political thing at the moment, there's a lot of discussion in the country at the moment about the way the structure of the House of Commons in Westminster creates a gladiatorial atmosphere designed to do that. I mean, I'm told it's 2.5 swords widths apart because they were afraid in the old days they would bring their sword out and stab each other. So you've got this very dysfunctional building, which is based on the kind of oppositional shouting at each other thing. I'm told it's deeply unsafe for women. They're now beginning to talk about all of that. In our electronic age, you have to queue up through a crowded corridor in order to vote. Most other assemblies in the world have an electronic system. Can you reflect on all of that? Because the issue that you're raising has profound political implications for the way we actually run our country. And when I talk to female MPs, for instance, the very opposition to the very idea of tender conversations in the political realm makes it very difficult to achieve the kind of cooperative, pragmatic approach that you're talking about. So I'm a wee bit stuck in this issue at the moment, but I'd like you to reflect on it. I mean, have you ever been in the House of Commons in Westminster?
I have. I've been in both of the houses in Westminster, and I've also been in the chamber in Holyrood, and the difference is remarkable, isn't it? So Holyrood is designed to be a conversational chamber. It's designed for people to sit around the dilemma and bring their best light to it. And it's very clear that the parliamentary chambers of the Lords and the Commons in Westminster are designed for verbal dueling. That's the design, the dispatch box design. So partly we're living with a tradition of politics that is adversarial. And I think perhaps the same thing pertains in the law, that when we think about trying to resolve a dispute, if we take it to law, what we take it to is a tennis match. And increasingly, we're resolving that in the law by moving things not to the court, but to mediation, where we can now have a brokered conversation that allows us to feel heard and safe. And nobody's going to take their armor off if they don't feel safe. So I wonder whether the design of the chamber in Holyrood to accommodate a voting system of proportional representation, so it is necessary for parties to collaborate for anything to move forward. Is it the architecture? Is it the political system? Or do they each reflect each other to change the way the conversation progresses in Scotland, compared with the chaos that we so regularly observe, usually in the Commons, occasionally in the Lords? And then when you watch occasional debates, so every debate that there has been in the Commons and in the Lords about assisted dying has been courteous, respectful, and I think tender. So it can happen. And they do bear witness to each other's pain across the House when people stand up and speak from their heart and take their armour off. So we've seen it happen. We know that it can happen, but currently there is too much hurly-burly and not enough focus on a curiosity about finding a good solution rather than a politically expedient solution.
And still sticking with this theme, there's a book out at the moment called The Chumocracy, and it's about how particularly public schoolboys who run the Oxford Debating Union learn debating tricks. And the jokiness, the bravado, and all of that. And related to that is the fact that a lot of these guys are lost boys that were sent to these institutions very young. And so they develop this particular kind of rhetorical armor that you're talking about. It's deeply embedded still in our political culture. You need to get into these institutions and have these tender conversations so that these guys don't come out unable to be tender, because they learn that it's a kind of a weakness and the jokiness and all of that. But underneath it, a lot of them are just wee lost boys, aren't they?
Yeah, absolutely right. And when you look at thought leaders for the behavior of principled leaders, it's all about personal vulnerability. It's all about, I will lay down my armor first before I expect you to. And it even reminds me, in fact, of my family are all into Boy Scouting and Girl Guiding through several generations. And Baden-Powell noticed the South African tradition of shaking hands the other way around, the left-handed handshake, which involves you not putting down your weapon, but putting down your shield.
Yeah. Gosh, yeah. To go back to your talk, what do you mean by looking after yourself? Unpack that a bit. I mean, I was ordained as a young man to give myself away in the service of others. You get a lot of this in the rhetoric of priesthood. I suspect some of it's there in the rhetoric of doctors as well, this idea that you're giving yourself away to some great purpose and you burn yourself out, you expend yourself. And my God, we watched the NHS doing it during the whole COVID thing. How can you persuade maybe people who have a need to be needed to look after their own needs and to interrogate themselves about all of that? I could have done with a lot of this when I was a skinny young priest 50 years ago.
Yeah, that's a great thing to think about, because there's a difference between being a person who is helping because helping is the right thing to do, and a person who is helping because the high that I get out of being a helper gives my life meaning. And many people who go into helping professions, the church, medicine, nursing, and in fact, a lot of very pure-minded politicians do those things because being a person who helps other people is a thing that is fulfilling for them. And when we regularly are able to do something that's fulfilling for us, we are better for it. The problem then is that if we give ourselves into a system where there isn't enough gap between those episodes, we will burn out because we will run out of fuel. So I have a slide that I took out of this slide deck today for when I'm talking to healthcare professionals. And it's a slide about what happens a couple of times a year in the radiotherapy centre. So it will happen across Scotland in your big cancer centres, and it happens in my local big cancer centre too, where the linear accelerator machines that make the X-rays that give the radiotherapy treatment have to be closed down and cooled down in order to have their routine maintenance. And when that happens, we'll have one machine or maybe two machines out of commission. So that's half of our radiotherapy machines for maybe 48 hours. And that means that some people, patients, are not very well. They're having their treatment banked too late in the evening or early in the morning, or they're having to come in over a weekend or something a little bit inconvenient for them at a very difficult time for them. But the alternative is that we don't do routine maintenance of the machine, and it breaks down and it's decommissioned for weeks whilst it's being repaired. When we use an endoscope, at the end of the endoscopy, the endoscope is taken away, it's cleaned, all of its joints are maintained, it's sent to be autoclaved and sterilized, it's rewrapped in sterile wraps. There's a process, a recognized process of making sure that the equipment is fit for purpose the next time it's required. If you are a minister of the church, if you are a nurse in the National Health Service, if you are a classroom assistant in a special needs school, you are the most precious equipment in your workforce, because you are the equipment that's delivering the most important component of the care that's being given. You are listening, you are responding, you are holding, you are supporting. And if we don't do routine maintenance for you, you will go down. And it's no good having a sense of ministry that, Jesus was crucified for me, so I ought to be prepared to be crucified for these people. We're no good to people crucified. We're not going to bounce back 3 days later and say, oh, it's okay now. We have got to look after ourselves as part of, I'm going to use the word sacred, the sacred duty of doing the work that we do is to ensure that we can turn up well enough that the person that I'm helping this afternoon gets as much quality help from me as the person that I was helping this morning or yesterday. Because that's the way this works. And so if we run a system like the National Health Service at 90% capacity all of the time, if we're slightly under-resourced for the number of nurses, but it's okay because they're all really good and people work a bit after hours and some people will come in at the weekend, and it's running on goodwill and coffee. And then when something unexpected happens, it's not sustainable and it is damaging the people who are the deliverers of the service, and it's foreseeable that it would damage them, and it is negligent and a failure of the duty of care that a church owes to its clergy, that the NHS owes to its staff, that the education system owes to educators.
One of the things I wish I'd learned from your book was how to end a conversation. Because again, this kind of giving away life thing, I got involved in pastoral conversations I didn't know how to get out of. And you give lots of lovely little tips there. Is 50 minutes, for instance, the sacred time limit for certain kinds of conversations? Or is that too arbitrary? Can some people stretch it to 90? But we need to learn our limits, don't we?
I think we do. And particularly if we're dealing with people who are unwell, we may actually say, okay, well, it's really helpful if you set the limit at the beginning. What time do you need to finish? Oh, okay, well, that will work for me. Actually, if you need to finish then, if we finish just 5 minutes before that, I could even get an earlier bus. So let's negotiate. Then let's say, will you help me to keep an eye on the time? Because now it gives us both permission to look at our watches. Otherwise, we've got that awkward looking at your watch, but not really looking at your watch thing that goes on. And also now watching the person, because, okay, well, it looks like we've got half an hour. Fantastic. I've got the kettle on. You want coffee or tea? First 5 minutes is socializing, and then we're ready to start. And I think we've got 25 minutes left. And after 15 minutes, I can see that actually your eyes are starting to wander, that you're sitting in a more droopy position in your chair. And actually, we've got no time left because you have run out of juice. And this particularly happens in end-of-life care, where we've set time aside and it's too much time for the person. So one of the things I talk to medical students about a lot is how these conversations often are not an event, they're a process. And we might only have 10 minutes today, but we can leave it in a place where we can come back to it tomorrow or next week. General practitioners only have 10-minute appointments, but knowing that there's only 10 minutes can make it a very precious time. I worked with a ward sister in my very first hospice who always knew everything about every patient and their family. It was utterly astonishing. And I said to her, how do you do that, Margaret? That is just, I want to be like you. What are you doing? And she said, so what I do, Kathryn, said, is I have this cup. She said, it's got cold tea in it. I sit down beside a patient's bed and I say, I've just got 10 minutes for a tea break. And I just thought I would spend that with you, if that's okay. What's happening for you right now? What do we need to know so we can be the best we need to be for you today? And they think they've only got 10 minutes and they spill the beans. And actually, she would do that round the whole ward. And she would do it 3 times a week. So different people on different days. She was absolutely astonishing. Her background was community nursing. She was used to running into somebody's house, knowing she only had 10 minutes because she had to go and give an insulin injection to somebody down the road. How was she going to get what she needed to know out of this person at the same time as changing their bandages or giving their injection or whatever it was? So making the time explicit, you can do something really important in a tiny amount of time, provided there's a kind of compact between you that you understand how much time there is.
You talk a lot about the helpers, fixers. Is there a particular psychological profile of the helper in that sense? You know, almost the vocationally helpless helper who can't help being a helper, or the fixer. Again, men, I mean, I'm useless at, my wife does all the fixing in my house, but there is something about the male capacity for DIY and fixing things. I mean, is there correlation between those, all of those? Is there a psychological givenness about a lot of this stuff? So how did you find out?
That's a really interesting thing. And so there are a couple of reflections I've got on that. There's a book called Men Are From Mars, Women Are From Venus, by a psychologist called John Gray. And it's a very pared down and simplified examination of exactly that. And some of us are perhaps a little bit more feminine in our way of dealing with things, and others of us are more masculine, whatever our gender might be. But his central theory is that men on Mars, they live in their caves on their own, and they come out if they've got a particular problem and somebody else in the tribe might be able to solve it. They'll come out and they'll say, you know, I need to break open this rock, and somebody else will say, oh, I've got a hammer, you can borrow it. And then they go back into their caves. So when a man comes out and says, I've got a problem, he comes out because he wants another man to say, I have the solution to your problem and here it is. Meanwhile, on Venus, the women are living in groups and it's lovely and it's glorious and it's soft and it's pink and it's floaty and it's frilly. And when a woman says, oh, I've got a problem, all the other women coo and they say, oh, tell us about your problem. Oh, poor you. And they stroke her and they soothe her and they find the nicest cups of tea for her while she's having her problem. And they don't do very much about solving it, but she feels heaps better because she isn't carrying it inside her anymore. And then they marry each other. And she says, I've got a problem. And he says, I will fix your problem. And she says, you never listen to me. And he says, I have got a problem. And she says, oh, tell me about your problem. And he says, you never help me to solve anything. So I think it's oversimplified, but I think there is this notion that we can help each other in practical ways, or we can help each other in emotional ways. And some of us tend to the one and others of us tend to the other. And whichever way we tend, we need always have a kind of weather eye to, should I be doing what I always do right now? Or does this situation require something different? You know, if somebody yells, the house is on fire, the correct response is, oh, tell me about the house being on fire. You know, no, let's send for the fire brigade and get a bucket of water. But the other thing that strikes me is some people who are with us may be familiar with a psychological tool called the Enneagram. And it's used quite a lot in spiritual teaching as well. And it describes personality types. I think it's got quite an old provenance. But it describes these different personality types and the way that these individuals will tend to address the world. And there are, I can't remember, 12 types, I think. Mm-hmm. And one of them is called the helper. And the helper needs to be needed and actually feels very sad if they're not needed and can become quite manipulative in order to get you to allow them to be your helper so they can get what they need from doing the help. So that's distinctly a type. And a lot of us who are in healthcare have that personality. It's often because we've been rewarded in childhood for being helpful. And I will routinely talk about this in big groups of healthcare professionals and ask for a show of hands of how many were the oldest sibling. And it's astonishing what proportion of the room will be the oldest sibling. And they will have been rewarded as children for having been helpful. So they look for their emotional reward by being helpers for the rest of their lives.
Yeah. The Enneagram, I remember well, it taught me that I was an introvert and not an extrovert. And it gave me an excuse to avoid a lot of needless parties and social occasions. So, I think we're running out of time, but I want to talk about silence. You talk very beautifully about silence, almost giving it a kind of real presence. It's under real discount in our very connected world. I mean, I've even read of Christians who tried to give up their phones for Lent, but couldn't. It's, you know, easier to give up booze than the phone. And it's a pretty ugly world, this connected world, isn't it? You know, Twitter, all the stuff that, I mean, there's a court case at the moment which is related to it. Talk us through that. And is there any, have we just gone too far down that road to come back from it? Because it sounds horrendous to me, this connected world, the stalking, the horrible things that are said about people, the way particularly female MPs are being attacked at the moment. Grim, isn't it?
It's interesting, isn't it? The connectedness through screens. It makes me wonder, is it the screens or is it the way that we're using them? And we do know, of course, that the big corporations that design the facilities that the screens provide, they have addiction built into their algorithms. So they understand psychology and they understand how to get us to bite. So that, I think, is probably malice aforethought, and we need to be aware of that. But there's also the fact that, you know, those same phones, those little evil instruments, during COVID, for those staff who were stuck in the hospital, were able to talk to their children and grandchildren, access pictures of nature, find topics that they, mindfulness apps or prayer and scripture that got them through a really, really difficult time. So maybe it's something about our own need to be connected and the competition to be in the know. And so the court case that's going on at the moment between the two footballers' wives was actually about a breach of confidence by one of them for the other one, wasn't it? So she wanted people to, she wanted to be the first in the know, to let the newspapers know that she was in the know about something. So I guess it's all of those things, isn't it? It's the invention of dynamite so that we can more easily do safe coal mining, which then gets transported into using dynamite for weapons. It isn't the technology, it's what we do with the technology, isn't it, that's so difficult. So how do we find silence? Well, if we now are caught up with a phone, maybe one of the things we need to think about is how we ask the phone to help us to build in the silence. And some of these mindfulness apps, there's one called Headspace, there's another one called Calm, they will give you a reminder to take some time out. They will guide you through a meditation, or they will offer you just a background soundtrack that's timed, so you know that you're taking 5, 10, 25, however many minutes you can sit still for. Not very long in my case, and not improving no matter how much I practice. But just, we know that the practice of taking time to reflect and be silent is something that is good for us. It's something that translates into a more robust immune system. It reduces our blood pressure. It changes our stress hormones. So maybe if we can't find a way to build that into our lives by neglecting our phones, we can actually call upon our phones to help us to do that and be more mindful.
I'm going to end there, but thank you for that. And I'm going to start a campaign, Kathryn Mannix for Prime Minister. How's that? I mean, then we'd have a gentler, tender, more listening culture. But thank you so much, dear.
Thanks, Richard.